Following the country going to another period of lockdown, I wanted to give you an update on how the pandemic is affecting our trust at this moment in time. We are currently extremely busy. Today we are caring for 118 patients with confirmed or suspected COVID. That's more than the peak we saw in April, when we had 95 COVID patients with us. So we're busier with COVID patients than we've ever been. But it's not all about COVID, of course. Unlike back in March and April, we're also caring for patients with some of the normal conditions we see in winter, along with those needing emergency care. Those who unfortunately have had to wait for treatment since the first wave, and those we are now vaccinating against COVID. I've been asked questions many times about how busy we are compared to previous years, and seen comments that suggest that the NHS isn't actually struggling, and that's wrong. Those kind of year-on-year comparisons just don't work anymore. Due to social distancing and the need to strictly control the spread of infection, we simply have less space and less beds available than previously. This means we don't have the capacity that we once did. But let me be clear, the hospital is very busy and will continue to be so until we get this virus under control. Our staff are working tirelessly to care for many patients and will continue to need your support so they can be available to care for you should you need it. While restrictions on our lives bring the kind of personal and professional disruption that nobody would ever want, I believe the latest lockdown is necessary given the rapid rise in cases. I hope the restrictions introduced will stop the spread of COVID and ultimately save lives. Please play your part over the next few weeks and months by following all the national guidance. Here at GWH, we are working hard to maintain as much activity as we can, and we don't want anyone's treatment to have to be cancelled or delayed unnecessarily. That really is a last resort. But it's clear that with the numbers increasing as they are, we will need to cancel some non-urgent treatment, and anyone affected by this will be notified directly. So please continue to come to your appointments unless we notify you otherwise. Please follow the latest visitor guidance available on our website. Unfortunately, this generally means you shouldn't be visiting the hospital apart from in some exceptional circumstances, but you always contact the ward in advance. Our staff have worked exceptionally hard for a very long period, and by the time we come out of this lockdown, it will be around a year since we treated our very first COVID patient. They've shown incredible tenacity, and I'm extremely proud of what they have done. I know the people of Swindon and North Wiltshire are proud too, and this support from the community is hugely appreciated and hugely needed at this time. There's light at the end of the tunnel, and with the vaccine being rolled out, which gives us hope, but it's only by us all playing our part by staying at home that we will bring this virus under control. Finally, I want to remind you all that we are still open if you need urgent and emergency care, so please do come forward. If you're unsure as to what to do, please contact NHS 111 online or by phone. The NHS is always here to help you. Thank you and stay safe.